Recently, I had a viewer reach out asking me to cover a condition that causes you to wake up every morning feeling like you've barely slept and experiencing a constant and extreme level of fatigue that's comparable to those undergoing chemotherapy. Let that sink in. This is the reality of millions with chronic fatigue syndrome, and the best way to demonstrate its horrific impact is to show you. So this is from another YouTube video from Palo Alto Online, which does a really good job of showing the progression of disability and describing the hallmark symptoms of exhaustion and just how quickly it can derail someone's life.
He was really happy all the time. Whitney. Hey, Whitney. He just loved exploring and adventuring and seeing new things. He is just so full of life and energy. First, he lost his ability to travel. And then he was unable to work anymore. Stopped being able to take any photos because he couldn't set up the equipment. He wasn't able to get out of bed anymore.
So, myalgic encephalomyelitis, or chronic fatigue syndrome, is a complex illness characterized by severe fatigue that isn't improved by any amount of rest and can be worsened by any amount of physical or even mental activity.
When he moved in, we knew he had something chronic. He'd say he just felt dizzy. He'd have to stay in bed. It just went downhill. He just got more and more tired, and he was going to all these different doctors, and we just didn't understand what it was.
He got to the point where he said, I can cook my food or I can wash the dishes, but I can't do both. We thought, what a weird disease. You have no energy.
This disease affects so many different systems. You have cardiac involvement potentially, you have cognitive involvement. There's often most patients complain of brain fog and fatigue, obviously. So there's physical debilitation. Because they're sick so long, many patients are physically just completely disabled. They can't tolerate any physical activities.
So the exact cause isn't fully understood, and it's likely that multiple factors, including genetics, immune dysfunction, infections, and environmental factors, contribute to its development. But as with many autoimmune conditions, we aren't really sure what triggers it. The symptoms of ME/CFS can vary wildly from person to person, but commonly include persistent fatigue, which is often described as overwhelming and, again, not relieved by any amount of rest or sleep. It significantly impacts daily activities and may worsen with any amount of physical or mental exertion, which is a phenomenon called post-exertional malaise. Often people will go through periods initially where they think it's all in their head or that they're depressed, and they'll push themselves to ignore the symptoms and attempt to go about their days as usual, but then quickly find out that they pay for it tenfold the next day by their inability to exert the slightest bit of effort and are completely incapacitated. For family members, this is alarming to witness. Cognitive difficulties are also a problem as far as concentration, memory, and information processing, also known as brain fog. And this is compounded by the non-restorative sleep that they get. Despite spending adequate time in bed, they wake up feeling unrefreshed and even more fatigued, if that's possible. And anyone who has insomnia or are parents of infants or toddlers will attest to the fact that without sleep, life can be bleak. So much happens when we sleep. Our body heals itself. The brain stores new information and gets rid of toxic waste. Nerve cells communicate and reorganize. Energy is restored, and hormones and protein molecules are released. And when this doesn't happen, muscle and joint pain become constant companions. Recurrent headaches and migraines as well. Persistent sore throat and swollen lymph nodes may appear, as well as other things like digestive issues, feeling lightheaded or dizzy upon standing, sensitivities to light, noise, or certain foods. It impacts virtually every normal function of the body. And Kavita, the viewer that I spoke with, wanted to make sure that I relayed that if she had to describe her regular state of being with this condition, It is one of profound overwhelm.
It's a really terrible disease. It robs people of their life, and it robs their caregivers of their lives too.
The other problem the disease has is they don't look sick. And that affects doctors and it affects the public as well. Almost half the people I talk to, and they ask about my son, and they said, oh yeah, I had that once, which is totally incorrect. They couldn't possibly have.
I had a neighbor say to me recently, sometimes you just have to push yourself. It'll make you feel better. And I went, I understand exactly what you're saying, and you're right. When you have other illnesses that will help you feel better, it is truly something that you've never felt before.
With such general symptoms, particularly the fatigue part, it's gotten this stigma over the years that it's not a real condition. And that's actually, I think, one of the biggest problems. Many of them are told that they're crazy, they're lazy, they're depressed, when in fact they have real complaints. Most patients will see about 20 physicians before they're diagnosed with ME/CFS.
I think chronic fatigue is probably the last major disease we don't know anything about.
Often people who hear that someone has chronic fatigue mistakes it for the fatigue that they might experience after a long day or throughout a particularly stressful period of their own lives. And this is where there is a massive misunderstanding. And this is what leads to people saying, you don't look as sick as you're saying you feel, you just need more sleep, or you're depressed. Force yourself to go for a walk or get some exercise. This type of fatigue does not translate into anything approaching normal. And what many encounter is the labeling with terms like lazy, depressed, manipulative, crazy, unmotivated. And this only pushes them further into isolation, which ironically is often one of their greatest fears. So, diagnosing ME/CFS can be challenging due to the absence of specific laboratory testing or imaging studies to confirm its presence. It's typically based on a clinical evaluation, a thorough medical history, physical exam, and exclusion of other conditions that could possibly explain the symptoms. And the key indicators that are looked for include fatigue so severe that it interferes with their ability to engage in pre-illness activities. It has new or a definitive onset. It's not substantially alleviated by rest, and it's worsened by physical, mental, or emotional exertion. So to meet this criteria, a person would also need to experience at least one of these two symptoms: difficulty with memory, focus, and concentration, dizziness that worsens with changing positions from lying down or from sitting to standing. And these symptoms must also last for at least 6 months and occur at least half the time at moderate, substantial, or severe intensity. Another complicating factor is it can overlap with other conditions such as fibromyalgia, sleep disorders, irritable bowel, arthritis, just to name a few. And one of the most troubling things about this is sufferers normally have to contend with a really high level of doubt and skepticism until they're able to find a provider who understands what they're seeing in front of them and makes a concerted effort to work a patient up and rule everything else out. Some will endure years of seeing health providers before they get a final diagnosis. Management often involves a multidisciplinary approach that's tailored to each person's needs, and this may include a combination of lifestyle modifications such as pacing activities to avoid overexertion, cognitive behavioral therapy, graded exercise therapy, though there is a lot of debate about this. The idea here is exactly what it sounds like: starting an exercise plan with mild stretching for a few minutes a day and gradually increasing that as someone gains strength back. And this will often be created in conjunction with and monitored by a health provider. Medications can also be prescribed, such as those that help with neurological type pain, like Cymbalta, Lyrica, ibuprofen, or Neurontin. And you'll also see meds that help with blood pressure if you're getting dizzy with movement. Now, I speak with many patients who have chronic fatigue syndrome, and in my experience, These first-line treatments are kind of hit or miss. Logically, they should work, but everyone's body chemistry is different, and there are numerous factors that come into play with this condition. So, I recommend that you try them and see how you do. Keep an open line of communication with your provider and trial different combinations of treatments. Strong support networks are of the utmost importance, although maintaining any type of reciprocal relationships with loved ones or friends can be really very challenging because it's often a minute to minute, hour by hour unknown of how someone's going to feel when they have this. And the vast majority of people will not understand the degree of exhaustion that's experienced. And they'll either feel that they want to give that person space and not add to that, or they'll sometimes take it personally. They'll take the lack of contact personally. And it's very important to understand that someone suffering with ME/CFS may seem like they can't tolerate any amount of socialization, but they also fear losing those closest to them due to this dynamic, which just adds to their inner turmoil. Ultimately, right now, it's only able to be treated symptomatically. Research, however, is ongoing to better understand its underlying mechanisms, improve diagnostic methods, and develop more effective treatments. I recommend, if you've been diagnosed with chronic fatigue or have a loved one with it, that you go onto clinicaltrials.gov and search for a study in your area, because the more we learn, the better we're able to help those suffering with it. One of the most important things to avoid to decrease your risk are opportunistic infections like Lyme disease, which is very concerning and is often associated with chronic fatigue. So watch this video next to see just how dangerous these little buggers are. I'll see you there. Stay healthy and lucid.